With a 50% obesity rate in the U.S. and more unhealthy people than ever before, it is time to make America healthy. Welcome to Make America Healthy with Beth Shaw. If you're feeling tired, toxic, heavy, slow, or stressed, then keep listening. Beth and her expert guests are here to offer practical advice and share the tools you need to reclaim your physical, mental, and emotional health. Now, here is your host, Beth Shaw.
Hi, everyone. Welcome to Make America Healthy, your one-stop shopping for solutions for mind-body health. Our goal here at Make America Healthy is to empower you, inspire you, and educate you to be able to make better choices to take care of yourself. My name is Beth Shaw. I'm the founder of YogaFit Training Systems, the author of 4 best-selling books on health and wellness, and the host of this podcast, Make America Healthy. Today's topic is very intriguing. We are talking about toxins and trauma. Some things you don't hear together in the same sentence very often. Our guest is Dr. Jess Peatross, and she is passionate about discovering and uncovering the mysteries behind chronic illness, infections, heavy metal stress, trauma, and environmental toxins. She is a doctor, let me say that first and foremost, and she does a lot of functional medicine work. She also has a medical degree from the University of Louisville and works with hormonal imbalances, anxiety, adrenal dysfunction, and this all led her to seek alternative healing methods. She's trained in Gerson Therapy, functional medicine, and Ozone Therapy. So we would like to welcome Dr. Jess to Make America Healthy. Dr. Jess, this is an interesting intersection, toxins and trauma. Tell us more about that and how we put them together.
Absolutely. And thank you for having me too. I would say as far as toxins and trauma go, when I kept asking why about my clients and patients until I couldn't ask why anymore, it led me to a few different things. And one of those being trauma, which leads to nervous system dysregulation in the brain in a certain pattern, especially if we've sustained childhood trauma, which lets us believe certain things about people in general and love and our caregivers. From early on in life, this affects our relationships later on in life. And we've had a lot of studies show that early childhood trauma actually increases the risk of autoimmunity later in life. Trauma is a reason that people can become chronically ill later in life as the body keeps the score and trauma is stored in the body. The other thing that's stored in the body are toxins. We have natural emunctories, or what I call drainage pathways, which help us release the things that we are exposed to on a daily basis. And many of those things are things like industrial man-made toxins, heavy metals, pesticides, plastics, petroleum. Even though it may sound a little out there to people, that the people who have sustained more trauma throughout their life actually have trouble releasing some of these man-made toxins later on. And if you make the analogy, if you can't release a thought, how can you release a mold spore or a piece of plastic? The answer is you can't very well.
So what I'm hearing from you really, and something I believe, is that the mind is in control of the body. So we have to simultaneously clear the body of toxins, which we've had so many experts on this show about detox and cleaning the liver and cleaning the blood and cleaning out the digestive system. We've had Dr. Edward Group from Global Healing for a very, very impactful show. I guess it's also really changing one's mindset. Where do we start? Is this kind of a chicken and the egg thing? If someone was exposed to a lot of toxins early on in life, let's say they lived next to a chemical plant or, a factory that was producing some toxins in the air, are they going to be more susceptible to holding on to whatever trauma they incur? And given the fact that at least 1 in 4 adults have incurred some type of trauma, childhood trauma, this is a big bag to unpack.
Absolutely. I actually feel as though it's the childhood trauma that doesn't let them release the exposures and toxins later on. We know that childhood trauma from some of the studies can change the way our body methylate, and methylation is a huge factor in detoxification.
Okay, that is very interesting because I myself have had childhood trauma, and I myself am one of those 40% of the population that does not methylate vitamin Bs and such.
I myself, Beth, had high methylation on a test I did back in 2017. And since then, I've sustained a ton of trauma and have a diagnosis of complex PTSD. Now I have a severe B vitamin deficiency that showed up in my blood work. Although I had the genetic marker for MTHFR, which helps you detoxify and helps you methylate. If you have this mutation, you have an inhibition of being able to do that. I had that gene, but it was not activated until I had a stressful period in my life, which caused the enzyme MTHFR, the gene, to be continually pinged as you're with stress. Over time, that can wear that out actually as you need that enzyme more and more. This can cause problems with methylation. And my stress and my environment, which signals the genes, actually activated that mutation.
But that's fascinating. As someone who is a huge fan of yoga, meditation, and all things mind body, in particular, because I believe that when we practice yoga, obviously it helps our health, but also all the deep breathing, the moving, the twisting, the inversions, the back bends really change our system on a day-to-day basis. And this is also one thing where you don't have to seek out counseling or psychotherapy because it's inherent within the practice. Not that I don't believe in talk therapy, but I find it to be a very long and winding road, whereas perhaps something like plant medicine or done in the right environment can be a little bit more of a direct systemic hit in a positive way. How do people uncover all of these things? Most people are aware of the trauma that they have, but I personally know a lot of people who have had trauma and for whatever reason don't want to admit it, don't recall it, and just don't want to go there. Then they're having hormonal problems. They're having vitamin deficiencies. They can't sleep. Where does one start in all of this? Do you start with some type of physical testing, or do you have to go through a psychoanalysis evaluation? A lot of people won't even go there to find out what's wrong with them, which makes it even worse. Where does one start?
You brought up so many good points there. I think first and foremost, depending on the client or the patient you have, how open-minded are they to possibly a new perspective and to wanting to heal. I see a lot of people who don't want to heal necessarily, and dare I say.
And what do you think that's about? I know people who can't sleep, yet they're resistant to take anything from magnesium to theanine to tryptophan to a CBD gummy, melatonin. What is the psychology behind knowing there's a problem and yet not wanting to solve it? I know we may be getting a little bit off topic, but we're going to circle it back around to healing pathways.
It really goes back to their trauma and the way they were raised and the environment, the energy they were immersed in and told were normal as a child. Some people are so anxious. They look cool and calm as a cucumber on the outside, but on the inside, their mind is going a million miles a minute. I mean, they can't stop this freight train. Those people, any sort of bad news or possibility of change can be terrifying.
And do you think that they don't want to stop the freight train on some level because they're getting some payout for suffering?
Sometimes the sympathy and just the community and kind words from others is the motivation. Sometimes people are starved that much for human connection.
Or individuals who think that they can take care of it themselves, but then don't take the action to do so.
Oh, yes, absolutely. Someone who's hyper independent that's actually a trauma response.
Hyper independence. I have not heard that term before.
Yes, hyper independence. You don't need anyone or anything else, and you can do it all yourself. Is often a trauma response I see in men.
Interesting. Do you see it in women at all?
Yes, of course. I don't want to stereotype anything or put people in a box, but most of the time I see men as more of a dismissive avoidant and more women as anxious with their health conditions.
That's a new one for me as well. Thank you.
That's actually a term used in a lot of romantic relationships, but I see it as well in their health care, the care of themselves and the relationship with themselves.
So I have also a theory that how we do one thing is how we do everything. And this is a good example of that. Yeah.
That's one of my favorite sayings, actually. I can't believe you just said that. Absolutely. So going back to what you asked a minute ago, though, about what do we do about this? So once they have their mind opened enough to maybe try something different, to look at something different, one of the first things they can do is take something called a hair mineral test or HTMA test. It helps look at different minerals in the body. It helps people see if they have a calcium shell, if they're stuck in sympathetic overdrive or fight. You can get little nuances on that test to be able to tell how people are doing. The other thing is just that can be a little more hard to get for some people. So just regular blood work from LabCorp or Quest, an astute physician or practitioner will be able to look at the nuances in the blood work and see if someone is stressed from that as well. There are certain inflammation markers, laboratory values that you could look at, and to a trained eye, see when someone is really stressed out in that blood work as well.
Can you just give us an example for our listeners about what some of those markers may be?
Absolutely. Just a regular complete blood panel, because CBC, really different sizes of the red blood cells.
Okay, I want to stop you there because I've been doing a lot of studying right now on macrocystitis, I think it's called.
Yes.
Which is something I'm familiar with.
Interesting. Yeah.
We should have had this meeting in person. After this, we will. I'm going to take another detour and let's talk about that for a second.
Sure. Macrocytosis. So what you're thinking about is maybe the mean corpuscular volume, or MCV, yes. The MPV, the mean platelet volume, the MCHC, the red cell distribution with the RDW. When those numbers start to pop off, most of the time in something like a B12 or folate deficiency, you'll see most of those numbers have popped up. Like the red blood cells are too big, and that's what the macrocytosis doctor term is for cells that are too large. They may have different varying sizes and be abnormal in different ways depending on the mineral deficiency or what's going on. There are a number of different things that can cause large cells, but specifically for me, it was a B vitamin deficiency from stress.
Interesting. Then you're not methylating the B vitamins, so you have to, I'm assuming, take them intravenously. I inject myself with B vitamins a couple of times a week.
It actually drove me to create my first product, which is a Life Nano emulsified product that you absorb 100% in the mouth, in the buccal cavity here, because I was so stressed out. I was eating red meat and still not able to absorb vitamin D, zinc, my B vitamins. My iron was in the toilet. My ferritin was in the toilet. And that is because I was so inflamed from stress.
What was your road to recovery? Did you start studying all of this before your trauma or afterwards?
I knew about trauma beforehand, but that's the funny thing about trauma. It's so hard to see yourself. You can see other people when they're traumatized, but it's so hard to see yourself, and you'll think you're dealing with something okay, and you're not. And a lot of people who are heady in their head, who are always thinking, and never in their body, will make this mistake because they aren't in touch with their body. I'm a very critical analytic thinker, so I'm up here a lot. I need to be more in my body. The road to recovery for me was getting blood work and being honest with myself that I had really gone through a hard time during the last 3 to 4 years, very stressful, chronic PTSD, like complex PTSD type of picture, and that I needed to ask for help because even healers need healing.
Yeah, in fact, they often say we teach what we need to learn. I remind myself of that as a teacher of yoga all the time. I wrote this book came out right before the pandemic, called Healing Trauma with Yoga. When I see you in person, I'll bring you a copy.
Oh, I love this.
Yeah, the first chapter actually is the ACE test, Adverse Childhood Experiences. And from that test, I believe that if you answer yes, there are 9 questions. If you answer yes to more than 5 of them, you have had some type of childhood trauma, which then can impact your relationships, your work, your health, pretty much everything. I would share with our listeners, get Healing Trauma with Yoga. It's a great book. Take that Adverse Childhood Experiences test, as well as getting blood work. What else can we do?
I think that really the problem with most people is today's lifestyle, modern lifestyle. It's very hard to mitigate stress if you're working 12, 14 hours a day. It's very hard. And then you have people who are single mothers or single parents with children. I can't even imagine. So it's hard to tell people, hey, change your whole lifestyle. But what I try to do is tell people, we may not be able to fix everything in your life that's causing stress, but I can fix it possibly to where your body doesn't feel the impact of the stress as much. One thing that we can do with people is really make sure that their home environment is conducive to peace. What do I mean by that? Do they have something like water damage in their home? This is one of the most overlooked things. And people think, oh, mold can cause watery, itchy eyes or sneezing or allergies. That's a general portion of the population. And for the short term, will have those symptoms. There is a small portion of the population who, depending on their stress, how full their toxin bucket already is, amongst other things, that if they get into a moldy house with water damage, they're literally going to have eczema and palpitations, heart palpitations, and insomnia, and then eventually autoimmunity. And it's a risk for cancer too. And these people will immediately go into nervous system dysregulation when they live in water damage, and we can't calm them down. We can't get them to sleep. They're pinged and hypervigilant all the time because their nervous system is seeing an appropriate foreign intruder. The body is reacting appropriately. So something like that needs to be tempered in the home. The other thing is something like household cleaners, toxic laundry detergent, all that kind of stuff that works as an endocrine disruptor, as an estrogen mimicker. And everybody knows when we have high estrogen right before our periods, we're puffy, we're irritated, all the things.
We want to kill people.
Yeah, you're homicidal. All of these things can help people's moods. It can help our ability to really decrease inflammation and stress in the body, which can present in the mind. You have to think if something's in the gut and causing gut inflammation, it's also connected to the brain via the gut-brain axis. You're going to have neuroinflammation. You're going to have
now we're looking at microbiome testing, which I've also done, and even someone who appears healthy. I work out 5-6 times a week. I'm doing 6-7 hours of yoga a week. I'm standing on my head every day.
I love it.
But I had my microbiome tested about 1.5 years ago, and it was not pretty at all. It took about 6 months of taking different supplements to get it back to a baseline.
Yep. It's unfortunate. I think that so much of our food is covered in pesticides and Roundup Ready, and there's very few guts that can handle that exposure long term and not have some sort of permeable gut membrane or leaky gut dysbiosis.
Yeah, and not to mention the glyphosate that I have found out now. It's not just sprayed on the wheat crops, but I've been gluten-free since 2012. And I recently was very disappointed to hear that my favorite gluten-free chickpea pasta was swimming in glyphosate. And I always thought, oh, gluten-free. No, that is not the case.
I know exactly what brand you're talking about too. And it's a shame because I also love that.
It is a shame. I love that brand, and I was actually going to invest in their company about 6 years ago.
Oh, yeah. Their pizza, their frozen pizza, if I ever want a treat, was my favorite because you couldn't even tell it was gluten-free. And so that goes to show you that much of our grains in general are being poisoned. And the food, even organic food, it's so hard to keep the residues off of because glyphosate is an aerosol.
It basically makes you not want to eat anything once you know too much. And let's get into bottled water.
Oh, gosh, that makes me so mad too. The studies that have come out about the bottled water and how it's not even as clean as you'd hope for when we're paying for something like that too. And then even take away the microplastics in every single plastic bottle, just even the bottled water in glass, some of them have come back with studies with heavy metals and forever chemicals and things. So it's really disappointing to see. I call myself the Grim Reaper of fun because I know too much. So
I can relate. It's not always great to know the more challenging life becomes. Tell us a little bit about what you eat and what you drink and how you avoid all these things.
Absolutely. So first and foremost, those who are listening out there who think, gosh, that really resonated when she was talking about flight or fight and the gut-brain axis, and I need to calm down. I don't want to give you guys all this information so that you freak out and you don't know how to be a human being. You're only a human doing. So I'm going to tell you how I stay healthy. And to be honest with you, I'm going to shoot it to you straight right here. I don't always do everything 100%, even though I know that I should. I'm going to be real. I'm a human. Yeah. I'm a human. And sometimes I like to have fun. So sometimes I'll have the healthiest glass of wine at a party I can find. Sometimes I'll have a glass of wine.
Well, let's not even get into wine and
it's really
pesticides that are in wine.
And absolutely.
Most organic ones are, quite frankly, not that good.
No, absolutely. I'll give you a good one that I really like called
Okay.
Secco wine from Italy. If I had to do everything I know to do every day long, I would be in survival mode. So I really want you guys to know the information, do the best you can, and that's good enough. Don't dwell on everything because nothing will ever be perfect. So what do I eat? I am also gluten-free. I love dairy, but I try to only eat raw or goat cheese or feta if I have it. But I will tell you guys, I loved it. There was a time when dairy was my favorite food.
I love dairy as well, even though I'm slightly lactose intolerant. And I heard something recently about something they're putting in most processed cheeses that is really not good for the system. Did you read that?
I know they make cheese with rennet, but I don't know. It's probably part of the pasteurization process. I haven't read fully about what they're doing yet. I just try and avoid most of the stuff. Honestly, if I could get it raw cheese from a local farm all the time, I would probably eat it a lot more, to be honest. And then I eat a lot of grass-fed beef. Really got a lot of pastured chicken. I eat a whole heck of a lot of eggs. Pastured organic eggs, I think, are almost the perfect food. I eat eggs every day almost. They can be inflammatory for some people, but I'm lucky. And I do think that there's a difference between conventional store-bought eggs and pastured organic eggs for people. I eat fish as well. Wild caught, yes, not farm raised. Absolutely. Thank you for that. Yes. And then I have an AquaTrue sitting right here with reverse osmosis water they add minerals back to. I think the water and the food are very important. And I make sure that my house is at less than 60% humidity. It has good airflow. It's really nice to have a building biologist come by once to make sure you don't have any problems with EMF, dirty electricity, or moisture airflow problems that could precipitate mold or water damage. And I move my body every single day. I work out every day. After we get off this podcast, I'm going to work out.
Me too. I'm going to go to the gym when we're done.
That's right. Because if you breathe properly, you eat properly, you drink properly, you have good thoughts, you have a good supportive community, and you move your body every day, you are going to start to heal.
Tell us some success stories that you've seen with some of your clients.
Absolutely. What I'm known for out there besides environmental toxins is mold, obviously, and parasites. So I deal a lot with gut health, with mystery symptoms with people, chronic fatigue, brain fog, all that kind of stuff. One of my secrets that really help people is I ask everyone who comes to see me if they have root canal. And that is one of the biggest reasons that people are sick. They don't understand that man-made objects like breast implants and root canals usually have a lifetime of about 10 years or so, depending on the person and what's going on in their life and their body. Many times people have symptoms systemically away from the mouth that would not cause one to suspect a root canal as the root cause.
And that would include metal fillings too, is that correct?
Mercury amalgams as well. Yes, absolutely. Those leach with hot bites or drinks into the cranial cavity as a vapor. Root canals, we cut off the blood supply, and there's thousands of tiny porous channels within the mouth where bacteria can hide. We leave the periodontal ligament, which signals to the immune system that there's not a problem there. And then people sit with a simmering, what we call interference in the body for years sometimes before it's found. And this really helps people's brain fog, helps people's autoimmunity, helps people's eczema. So I've had people have their root canals pulled out and they start crying immediately from emotional relief. And then they have the clearest brain they've ever had since they've had the root canal. This has happened time and time again to me. Eczema will go away. Things like this. Really getting people out of water damage, getting people to calm down. Those two things are huge for people. It can really reverse many mystery symptoms that people have been told they'll have to be on a medication for the rest of their lives.
So this is really a kind of a total environmental mind-body assessment that needs to go on. Years ago, I came up with a concept for a TV show called Zentervention. I actually filmed the
How
pilot,
cute.
never did anything with it. And it was everything from the house to the body, to the mind, to getting organized, clearing the clutter, all of that, to really experience a life change. Do you have some kind of a written roadmap, maybe on your website or something, about
I do.
how people can start?
Yes, I do. I actually have a membership called Wellness Plus where we have a hand-holding protocols to help people understand what paths to take, what biohacks should be used, what supplements are helpful, depending on what they're dealing with. I really like to get people to calm down. then open drainage, which means making sure their liver's working right, make sure their bile is flowing, make sure they're pooping a proper amount of times a day. They can sweat. Okay. People tell me they can't sweat. I'm like, that's not normal, guys. You know that, right? So these are the ways we release metals. We release toxins and pathogens are killed off in our body with heat. This is the way we release things that do not belong. So once I calm people down, we release what doesn't belong after that. And then finally, we rebuild back. And these are the steps. And it's done all natural and holistically, just as nature intended. And people usually do very well when you go slow with them and you have the proper steps.
So you mentioned going slow. What is the average length of this protocol? How long does it take before people start to feel better and see differences?
Usually 2 months or so for most people. There are some stubborn cases. Sometimes it take me 4 or 5 months to figure out, depending on the person. It's almost like you have to go to their house and hang out with them to really see what the root issue is sometimes. Because people, they have a very hard time seeing themselves and reporting back accurately. Sometimes the testing isn't always perfect. In general, if I'm dealing with someone, let's say a chronic Lyme client, these people can take sometimes 8 months to a year to feel better because Lyme is really quite the battle. Yeah, that would probably be the longest case.
Lyme is interesting too, because that's 5, 6 years ago, I got bit by a tick on a corporate retreat out in the Hamptons. Within 5 days, I was 104 fever, headache, sweating. It wasn't Lyme, it was some other type of a thing. Fortunately, it didn't become Lyme or turn into it. Do you think that people are more susceptible to Lyme disease if they have had some type of trauma?
Yes. 1000%. Actually, on a lot of bioresonance scans, Lyme will resonate with the feelings of abandonment and victimhood. And so having that trauma that leaves those residual emotions in the body prepares you or makes you more a reason for the bacteria to be there. And why do I say this? Bacteria's jobs in the ecosystem is to digest organic waste. That's what they do. That we are part of this ecosystem. Thoughts and feelings can be part of that ecosystem that needs to be digested, just like metals are, just like putrefaction in the gut from your food is.
You really do start with the body. And then I'm assuming that you turn the trauma over to a psychotherapist or a coach, counselor, something like that, or do you do that work with your clients yourself?
I have health coaches that really help me, are trained in that very, very much, and trained in things like HTMA, hair balancing, and hair mineral tests as well, that help us look at if the patient is actually stuck in flight or fight or not. I also do a lot of nervous system dysregulation programs, things like primal trust or DNRS, somatic work with people. So I often will refer people out, but I have certain things that can help people too. For example, coffee enemas will often put people in parasympathetic mode. Things like meditation, like you mentioned, things like a PEMF mat or certain little biohacks I have that will help.
That reminds me, I need to pull my PEMF mat out. I'm in Florida, so summertime is not the time that you want to be on a PEMF, but it's been very helpful for myself and also for my dog who's got cancer.
Oh, yeah, the dogs, they know they can feel the frequency. They'll go right over and lay on it. My dog did too, for sure. So it's certain things like that, but ultimately it's really the client is the one doing the work. I am just a mere guide. It is the client doing all the work.
And are you sending people for more advanced blood work testing, like to a SpectraCell? Quest and LabCorp, okay, but they don't really get in there.
Yeah, for sure. I've definitely done SpectraCell micronutrient tests before. I err on liking the hair balancing and mineral tests better, but I definitely the SpectraCell is great too. That's a great test as well. I've taken that personally.
Yeah, I actually really love them. I also am a big fan of one of our main sponsors for Make America Healthy is Previmedica Cell Sciences. And they do micronutrient testing, micronutrient deficiency testing, methylation testing, food allergy testing, which was really interesting to me because a lot of things that I was eating and I thought were healthy, like avocados, arugula, and broccoli, were actually slightly inflammatory to my system.
It's because usually that's because of leaky gut. Usually you can fix the gut and some of the food intolerances go away. Usually, but not always, of course.
Right. Where is your practice, Dr. Jess?
So actually, I am not practicing right now in a brick and mortar. I am practicing as right now as a health coach virtually. So people can see me from all over internationally, even virtually if they want to.
and they just send a blood work to you. I would imagine it's hard to get into someone's home virtually, but they can probably give you a virtual tour.
Yeah, absolutely. I don't get to see their home as much as I'd like, but I do have extensive intake forms and questionnaires that help me get a lot of those questions. So I just review beforehand so I know everything about their history and their environment that I need to know up front. There's just a couple questions elsewhere.
And is this part of your Wellness Plus
It
membership?
is, yes. So if you go to Wellness Plus, there's a button that says help, and you can go to one-on-one consults, and then you can see book a discovery call with me and my team. And that's where people can book to see me virtually. Yeah,
And
I have a lot of
do we
fun.
have an affiliate code for our network?
I think you guys do, I believe. I actually don't know because I don't handle that side of things.
If you're listening to this podcast and you want a discount code, check out the show notes and hopefully we'll get that in and up there before the show airs.
Yes, there we
So
go.
tell us where we can find you.
Oh, yes, absolutely. So I have a different hierarchies for people who want to work with me. If you guys just like free information that's educational, I do a lot of teaching online. So you guys can find me on Facebook as Dr. Jessica Peatross or on Instagram as Dr.Jess.MD. And then same handle for TikTok. If you guys would like more upgraded attention or you like reading blogs or websites, you can see me at drjessmd.com. And then finally, Wellness Plus, which is the membership where you can ask doctors questions on an uncensored forum. We have different hand-holding protocols and courses. It's app.drjessmd.com.
Wonderful. I'd like to thank you so much for being on Make America Healthy. This has been very eye-opening for me, and I've learned a couple of new terms that I didn't know, like dismissive avoidance, hyper-independence. So thank you for that. If you're not feeling well, if you feel tired, toxic, heavy, and overloaded, it may be your childhood trauma, it may be your adult trauma, it may be environmental toxins. So the good news is that help is available out there. You need to do a little bit of the work towards that because we have to have intention and action to heal ourselves.
Absolutely.
We'd like to thank our program sponsor, Previmedica, offering innovative testing for food sensitivities, micronutrient deficiencies, methylation, and other state-of-the-art tests, as well as personal nutritional counseling and lifestyle consultations. These tests are super effective. I actually have done a lot of them myself. We've got weight issues, body composition issues, problems with headaches, breathing problems, and a host of other issues. Check out previmedica.com. That's P-E-P-R-E-V-I Medica.com. Cell Sciences, or you can call them at 855-773-8463, extension 111, or email hello@previmedica.com. Use code YogaFit to save 15%. And we'd also like to thank our title sponsor, YogaFit Training Systems Worldwide, the leader in yoga, mind, body, fitness education, offering over 250 different educational courses and trainings for consumers and professionals alike, including our 200-hour YogaFit Warriors program if you have had trauma, PTSD, anxiety, or depression. Save 15% at checkout by using the code M8. There's a conference coming up in September in Orlando, Florida, with over 15 different trainings, as well as Palm Springs in January. We offer corporate wellness. And last but not least, but not last, yoga for healthcare providers. So if you're listening, check out yogafit.com. Again, my name is Beth Shaw. Thank you for listening to Make America Healthy. You can find me on Instagram at Beth Shaw Health, and you can find all of my books wherever books are sold. So until next time, everyone, stay healthy, stay happy. And if you enjoyed this show and you know someone who would benefit from it, we thank you for sharing. Have a beautiful rest of your day. Stay healthy. Namaste.
Thanks for joining us on Make America Healthy. We hope we've given you some tools you need to take back control of your health. Until next time, we wish you a healthy and wonderful week.